In Focus Health correspondent Linord Moudou joins us now with news of an anti-malaria campaign. Hey, Linord, give us more.
Hello, Dimiake. Well, high-profile personalities are joining forces in support of the United Against Malaria campaign across Africa. The objective is to turn the tide on the disease, which remains one of the world's deadliest. According to the World Health Organization, malaria is Africa's leading cause of death for children under 5. The campaign encourages families to sleep under mosquito nets. Hervé Roussel is with the World Bank Malaria Partnership.
The United Against Malaria campaign is a campaign from NGOs, from foundations, United Nations and private sector. And all together, we want to use football as a vector to communicate on malaria. 2010 in Africa will be the year of football with the Africa Cup of Nations and with, of course, the World Cup in the second part of the year. And thanks to the support of FIFA and all our partners, we will use football to communicate in villages and everywhere in Africa and use football as a vector of communication on malaria.
And Elopet Jamet is a scientist studying malaria. She says insecticide-resistant mosquitoes are an emerging problem in fighting the disease.
Insecticides are one of the main methods that we use to control mosquitoes that carry diseases such as malaria. And what's happening is that mosquitoes in a lot of parts, particularly West Africa, are becoming resistant. It may eventually become difficult to control these mosquitoes if the problem continues and we can't find any solution.
To what do you attribute this resistance?
One aspect is agriculture. Mosquitoes breed in water, and in a lot of the areas where the mosquitoes breed, it's also in the same area where there's, for example, rice or cotton, and the insecticides that are used on those crops are the same insecticides that we use to control the mosquitoes. There's also, for example, when we spray houses, that can also help to create resistance. And basically, you have mosquitoes that manage to survive the dose of insecticide, and then they breed, and then you eventually end up with a mosquito population that can survive the dose of insecticide.
So, what in general causes resistance?
There are two main mechanisms that cause resistance. Insecticides, they have what's called a target site. They have to fix to a certain point inside the insect in order for them to work. And that point at which they bind inside the insect, it can change so that the insecticide doesn't bind as well anymore, and that means it doesn't work as effectively as it does in a normal insect. There's another type of mechanism called metabolic resistance, which is where you have enzymes in the mosquito that are working better or faster to break down or take away the insecticide so that the insecticide can't have its effect.
What do you see this trend happening in general in sub-Saharan Africa?
It's a widespread problem. For a long time there was a lack of monitoring. So for a long time we found cases of insecticide resistance where we had entomologists. So people would do a study and then we would find resistance there. But it would always be where we had people doing the studies. So now countries are starting to do a lot more monitoring activities themselves, and we are seeing resistance popping up everywhere. In some countries it is having an impact, particularly in countries in West Africa, and it's a worry that it could get to the point where the control methods that we use today won't actually work anymore.
So do you think that these methods are maybe outdated?
Certainly the insecticides that we're using, we haven't had any new class of insecticide introduced for over 20 years. We're using only 4 classes of insecticide. One of the main difficulties is that you need to have an insecticide that's safe, that's effective at low doses and safe to use in close human proximity, especially when we're looking at mosquito nets, when you're sleeping inside it and you have young babies that might, for example, suck on the net.
What should be the recommendations?
It's very important that countries malaria endemic countries are aware and do as much monitoring as they can, so that they can really monitor how the control tools they're using are working, because we don't want to be in situations in countries where we start to see malaria increasing because the control tools aren't working anymore. So it's much better.
And that's your health report. Dimiaki, back to you.
So informative. Thank you so much, Linord, for joining us and giving us that information. And of course, for you, our audience, please be sure to watch for Linord Moudou every Tuesday and Thursday for the latest health news in Africa, right here on In Focus. Now, Makori, you know, one of the, of course, places where mosquitoes thrive is overcrowded areas where there's a lot of just in bad sanitation. And what comes to mind? Kibera.
Kibera.
And there are these efforts by a group of young Kenyans who you actually brought to my attention, who are now trying to map it.
Yeah, it's
so
amazing.
that it can be found and so that people can actually have access to it.
Yeah, because this is Kibera being the biggest, second biggest slum in Africa after Soweto. In fact, it's home to about 1 million people, but for a long time, up to today, nobody really knows how to go around it. Nobody knows where what is. It is like just a black blur on the map of Kenya or Africa. So these young people are going out there. They're trying to map it and put it on GPS digitally.
Global positioning system.
Exactly, so that you can know where is a church, where is a mosque, where is this particular part of Kibera, because it's huge. It's got everything. It has thriving markets, it has stores, it has schools, but nobody knows how to locate them if you don't come from there. Even some locals, actually, some residents of Kibera may not know how to get around.
And what's amazing about it, as you described, there are 10 villages within Kibera.
Yeah.
And it's an active place. So why is it a slum, you'd wonder?
Well, that's the amazing thing, but you know, they're called what? Informal settlements. The government has not taken it upon itself to make these areas formal, give public service, provide water, sanitation and everything. So people fend for themselves. They do what they have to do.
Well, we'll follow it, see where this GPS mapping takes
it. And so viewers, don't forget to check out our Facebook page. You can share your comments or read some of the things others are saying. And check out pictures of the In Focus gang. Just look for In Focus on Facebook.